Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about the next step for the diabetic foot. A lot of times with diabetes, if you start to get peripheral neuropathy, they assume that you have diabetic peripheral neuropathy. You need to understand that there are over 150 different causes of peripheral neuropathy, of which diabetes is one. You can have symptoms of peripheral neuropathy, even significant peripheral neuropathy, that may be caused by other things, non-diabetic type causes. So even though you have peripheral neuropathy and have diabetes, you also need to look for the other possible causes, because there are other things that can be treated. So maybe you have diabetic peripheral neuropathy, but do you have vitamin deficiency peripheral neuropathy as well? Do you have other systemic diseases that are causing your peripheral neuropathy? Do you have a toxic peripheral neuropathy? Do you have a compression peripheral neuropathy? All of these different pieces should be evaluated, should be discovered, and so that when you ultimately get to the point that you want to manage your peripheral neuropathy, you're not putting all your eggs in one basket. You're not saying, okay, I need to get control of my diabetes to get control of my peripheral neuropathy. Yes, that will help, but if you have a vitamin deficiency peripheral neuropathy, you can do everything you want to get your blood sugars normalized and regular, and you will still have significant peripheral neuropathy symptoms from the deficiency if you don't treat the deficiency. So the point is, if you have peripheral neuropathy, you need to look at all the possible causes. You need to look at the whole picture and evaluate the non-diabetic causes of peripheral neuropathy and work on treating those, as well as treating your diabetes, even if you have a diabetic foot. So, takeaways from tonight is, if you have peripheral neuropathy and you have diabetes, you need to also assume that there's at least one, maybe two other causes that can be treated for your peripheral neuropathy. So far, in the patients that I've seen, I have seen 0 patients that the only cause of their peripheral neuropathy is diabetes. And so we have to treat other things as well. And we're seeing great results even as they continue to struggle to get their blood sugars where they want them. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 288, non-diabetic peripheral neuropathy. That could be the case.